As promised, welcome back to Nurse Eunice's live study session. Yes, we're going to understand our vital signs. If you haven't done so already, don't forget that I actually have a bundle. It is a vital signs bundle. You can go to nurseeunice.com or you can scan the QR code. It's going to give you these practice tests, the whole overview of the first video, and it comes with your vital sign documents. It's going to provide so much knowledge and resources for you, and it's only $7. So it helps me actually honor my team because we put in a lot of work, and sometimes we don't get paid for everything that we put out, but this is a way where you can support us the same way that we support you. And now there's a QR code on the screen. So if you don't know your skills, and I'm talking about things that you're like, oh my God, how do I take a pulse? How do I count respirations? Scan the QR code with your phone. Just open up your camera app. Whenever you hover the camera over the QR code, a link is going to pop up. You would go to that link and you can watch our full CNA skills playlist. It is going to show you every skill that is on your CNA examination. If there is an exception, let me know and I'll create that video for you too. All right, so question number 1. Which of the following is considered a normal range for an adult's resting heart rate? Would it be A, 40 to 60? BPM stands for beats per minute. Would it be B, 60 to 100? Would it be C, 100 to 120? Or would it be D, 120 to 140? So which would be considered a normal range for an adult's resting heart rate? All right, and because we just finished one review, I'm revealing the answer in 3, 2, and that is right. If you said B, 60 to 100, you have gotten it. Yay. So a normal resting heart rate for adults is typically between 60 and 100 beats per minute. Anything outside of that range could represent bradycardia, that would be below 60, or tachycardia, above 100. Question number 2, and we're going all the way to 100. So remember, if you haven't liked, shared, and subscribed, giving me a heart or a diamond, go ahead and do so. Question number 2. What is the most common site for taking an adult's pulse? Would it be A, the radial artery, B, the femoral artery, C, the temporal artery, or D, the carotid artery? Where is the most common site for taking an adult's pulse? Think about your CNA test. You have to know the names of those pulses, though. You just can't be like, oh, the pulse in the wrist. The pulse in the wrist has a name, and that's right. I see Dina on TikTok. Dina said radial, and yes, I see you all too. So the answer is A, it is radial. So the radial artery located on the wrist is the most commonly used site for taking a pulse due to its accessibility and ease of use. Question 3. Which blood pressure reading is classified as hypertension? Would it be A, 110 over 70? And remember that mmHg stands for millimeters of mercury. And so remember, that's talk about pressure. So would it be A, 110 over 70, B, 120 over 80, C, 130 over 85, or D, 150 over 95? Which one, team? All right, revealing that answer in 3, 2, and I see the correct responses. It is D, and the nurse goes wild. So hypertension is defined as a blood pressure reading of 130 over 80. For your nurses, we tend to not really care until it's 140 over 80, which is why I have that on the screen, or higher. So the reading of 150 over 95 is indicative of hypertension. You're doing so well. And we're going all the way to question 25. So we're doing 25 questions. Question number 4. A CNA is caring for a patient who reports dizziness upon standing. What is the most likely cause? Would it be A, orthostatic hypertension, B, orthostatic hypotension, C, tachycardia, or D, hypoglycemia? Oh, I know you're going to get this right. I'm going to drink some water because I know you're going to answer this one correctly. Absolutely. Nope, I tricked you. It's not A. Orthostatic hypertension doesn't exist. I guess it does, but we don't monitor for that because we expect for your pressures to change and elevate when you're up and you're moving. What we don't expect to happen is B. Orthostatic hypotension. We don't expect for your blood pressure to significantly drop whenever you stand up because that can cause dizziness or lightheadedness. Question 5. What is the normal range for adult respiratory rates? Is it A, 10 to 14 breaths per minute? B, 14 to 22 breaths per minute? C, 12 to 22 breaths per minute? Or D, 22 to 28 breaths per minute? Whew, that was a lot. What do you think, team? The normal range for adult respiratory rates. And if you answered C, you are absolutely correct. So the normal adult respiratory rate is between 12 to 20 breaths per minute. Rates outside of this range may suggest respiratory distress. And here's a helpful hint, because a lot of you all, when you take your test is geared toward adults. But some of you are going to want to work in pediatrics. So once you pass your CNA examination, before you go and interview at that children's hospital, I'm going to need for you to actually review pediatric vital signs because their heart rates are lower. Their blood pressures are lower. Let me correct myself, but their heart rates and their respiratory rates are higher. So pass your test, you're going to learn about adults. But then if you want to go work at Wolfson's or Nemours, you're going to have to learn more because your CNA examination is focused on adults, those over the age of 18. Question 6. A temperature of 102 degrees Fahrenheit is classified as which of the following? Would it be A, hypothermia, B, normal, C, afebrile, or D, febrile? And that's right, you just learned your medical terms in our last video. So I'm giving you 3 seconds. 3, 2, and that is right. It is D, febrile. So whenever a person has a temperature that is greater than 99.6, even though your nurses and your doctors, they may not be moving fast because someone's temperature is 99.9. But if it's greater than normal, especially when this person's temperature was 102, that is indicative of them having a febrile state or having hypothermia, which more than likely means that they have an infection that is causing their fever. Question 7. What is the best position for a patient who's experiencing difficulty breathing? So you knowing the vital signs is kind of like 25%. You have to know the vital signs. You have to know what to do when a person has an abnormal vital sign. You have to make sure that you notify the nurse, and then you have to make sure you document it. And then you have to follow up. So it's a lot that goes into vital signs. So with that being said, which of these positions is best for someone experiencing breathing difficulty? Would it be A, supine, B, prone, C, Fowler's position, or D, Trendelenburg? And thank you all for my gifts. I appreciate them. Yay, I'm learning TikTok. I'm sorry, let me focus. All right, and so for question number 7, the answer is C, Fowler's position. That's right, sit them up. So sitting a patient upright helps to ease breathing by allowing the diaphragm to fully expand. Question number 8, we're going to 25. Question number 8, a bedbound patient, bedbound, think of these key terms. A bedbound patient with a blood pressure of 90/60 is experiencing which of the following? Is it A, hypertension? Is it B, hypotension? Is it C, orthostatic hypotension? Or is it D, hypertensive crisis? And don't forget, for my people who are watching on on TikTok, these slides and everything will be available on YouTube this evening. And then I'll upload them to TikTok sometime later. So I'm trying to figure out how to do slides on TikTok, and I don't know how to do that yet. So bear with me. All right. And so remember, for this particular question, the person's bedbound. So a bedbound person is not going to be standing. Therefore, it is not orthostatic hypotension. They just have regular hypotension. It is B. So a blood pressure reading over 90/60 is considered low, indicating hypotension. And the reason why it wasn't orthostatic is because the blood pressure didn't drop significantly with position change, such as standing, because that person was bedbound. Question 9. Which of the following symptoms may be associated with bradycardia? I expect everyone to get this right. Would it be A, shortness of breath, B, dizziness, C, chest pain, or D, all of the above? And let me give you a hint. If you haven't seen an all of the above before and suddenly there's an all of the above, chances are the answer is all of the above. So yes, it is D. So think about what happens when the heart pumps blood. Oxygen is carried in the blood. So if a person's heart is beating slow, they don't have enough oxygen. And so they can become dizzy, they can have shortness of breath, and yes, they can have chest pain due to the decreased blood flow. So bradycardia can cause all of those symptoms. We don't expect you to know that as a CNA. We expect for you to call that nurse into the room so he or she can come and assess that patient. Question 10. When taking an oral temperature, the CNA should wait at least how long after the patient has eaten or has had a cold drink? So you go into my room, I'm your patient, and I am drinking coffee, and you have to do vital signs. I know you're not coming back, but I need you for the test to not take my vital signs right then. Don't take my temperature right then. How long would you wait before you check my temperature? Would it be A, 30 minutes, B, 20 minutes, C, 15 minutes, or D, 10 minutes? Aisha, that's not the right answer for the test. Yes, Melissa, it is A, you all. You have to wait 30 minutes. I know what we're going to do in the real world, but I need for you to pass your test. Remember, this test is about perfect care. It's not about you having 15 patients where you have to rush. If you're going to pass your CNA test, you're providing the safest and the most perfect care. It's not real world. And do we not provide good care in the real world? We do provide great care in the real world, but we have our limitations. It's one CNA is 20 patients. If you try to come back 30 minutes later, you're more than likely going to forget that temperature is never going to get done. So I know what we do in the real world, but I need you to pass your test so you can actually be working in the real world. So answer these test questions the way they're supposed to be answered. And so according to the Mayo Clinic, not according to Nurse Eunice, it is recommended to wait at least 30 minutes after eating or drinking to ensure an accurate oral temperature reading. Question 11. Which of the following pulse rates is considered tachycardia in an adult? Would it be A, 50 beats per minute, B, 75 beats per minute, C, 99 beats per minute, or D, 120 beats per minute? I know, is it C or is it D? Well, technically, C is 99, which sits between 60 and 100. So even though you don't like to admit it, C is still normal. It's just on the higher end of normal. So the one that would represent tachycardia would be D, 120, because that reading is greater than 100 beats per minute. Question 12. The CNA is monitoring the patient's blood pressure and notices a consistent increase in the systolic pressure. Oh my God. His pressure went from 160 to 170 to 180. It is the systolic, the top number, the sky number that keeps going up. But there's no change in the diastolic pressure. This may be a sign of which of the following. I'm teaching you new words. Would it be A, isolated systolic hypertension, B, orthostatic hypotension, C, diastolic dysfunction, or D, dehydration? Think about the key terms. Only one of the readings is going up. Therefore, it is isolated. So yes, it is A. So new term, isolated systolic hypertension. That occurs when only the systolic pressure is elevated. So their diastolic is normal, but that top number is high. That is common in older adults. So if you ever see that, yes, you're still going to notify your nurse, but it's like, why is only one number elevating? Because normally they both would be high if a person had hypertension. 13. A patient reports feeling lightheaded when moving from lying down to standing up. What should the CNA do while waiting for the nurse to arrive? So your person got lightheaded when you change your position. What are you going to do? Are you going to do A, elevate the patient's legs, B, take the patient's blood pressure, C, assist the patient to walk around, or D, offer water? So you did call for the nurse. The nurse is coming. But what do you do while you're in the room with a patient who's lightheaded? Oh, we're torn. I see A's, I see B's. All right. And so I know you want to elevate the legs, but you're a CNA. I need for you to take the vital signs because his heart rate could be low too. His O2 sat could be low too. And you're down there putting pillows beneath his legs. And so that's cute, but that's something you can do when the nurse tells you to do it. What I need when I enter the room is a full set of vital signs. So anytime there's a change in a patient's condition, you're calling that nurse and you're getting those vital signs. All right, question 14. Which of the following temperatures indicates hypothermia? Hypo. When I was in nursing school, I was so po, I couldn't afford the other OR. I wasn't poor, I was po. All right, so which one indicates hypothermia? Is it A, 97.6? Would it be B, 98.4? Would it be C, 95 degrees even? Or would it be D, 100.2 degrees? Hypothermia. Hypo prefix low. Thermia referring to body temperature. Person has a low body temperature. That means that their temperature is less than 97.6. So the answer would be C. Great job, everybody. Question 15. How long should the CNA count a radial pulse to ensure accuracy? I know you know this. Is it A, are you going to record it for 10 seconds and then multiply the number that you counted by 6? Would it be B, actually count for 15 seconds and then multiply that number by 4? Is it C, 30 seconds and multiply that number by 2? Or is it D, 1 full minute? How long do you count the radial pulse for? Ew. I need some correct answers. I see Melissa has a correct answer. Do you have a correct answer? That is right. It is 1 full minute. I don't care what they do in the real world. Pass your test. So counting the pulse for 1 full minute ensures an accurate reading, especially if the pulse is irregular. And I'm keeping the track on the time because I got an appointment that I got to be to in like 17 minutes. So I got to get out of here. All right. So question 16. When measuring a patient's respiratory rate, the CNA should do which of the following? Would it be A, inform the patient you're counting their breaths? B, measure right after taking the pulse without telling the patient? C, count respirations for 15 seconds? Or D, ask the patient to take deep breaths? Team, what do you think? What do you think? That's right. I see all those correct answers on TikTok and I see the answers on YouTube too. So yes, it is 16 is the answer is B. So respiratory rate should be measured without the patient knowing. So remember for your CNA exam, even though your paper, your test plan, it's going to say count the person's respirations. That word cannot come out of your mouth in your introduction. Instead, you'll say, hello, my name is Eunice. I'm your CNA today. I'm here to take your vital signs. That's going to help keep that element of surprise so they don't change their breathing pattern. Question 17. A patient's blood pressure is 180 over 110. What should the CNA do next? Would it be A, recheck the blood pressure in 5 minutes? B, lecture the patient about proper diet and exercise? C, notify the nurse immediately? Or D, encourage the patient to rest? All right, 180 over 110, you all. That's right. Get your nurse in the room. Anytime there's a change, nurse, vital signs. The nurse is always first. Get that nurse in the room because 180 over 110 requires immediate medical attention because that's stroke level. By the time that systolic gets to 200, we got to start IVs, give them all types of medication to try to bring that pressure down because those increased pressures, especially if their heart rate is irregular, it can cause clots to form and clots to travel. So we got to get those pressures down. 18. Which of the following symptoms may indicate a fever? Would it be A, chills, B, sweating, C, elevated heart rate, or D, all of the above? Hint, hint, hint. This test is so easy for you all. I hope you're proud of yourself. That means that you know your vital signs. So yes, it is D. So fever is often accompanied by chills, sweating, and an elevated heart rate as the body tries to regulate the temperature. So D was the correct response. 19. What is the most accurate method for taking a core body temperature? Is it A, oral, B, rectal, C, tympanic, or D, axillary? Make sure you say axillary and not auxiliary. So axillary. What's the best method for taking a core body temperature? And Sherry and Christina, I see you over there in TikTok world. So yes, you all, it is B, rectal. Think about, and I hate to use this analogy, whenever you're baking a turkey, you do not stick the thermometer to tell if the turkey's done under the wing. You stick it inside. We need a core temperature. We need a temperature that's internal, that is not affected by the environment. Remember, these hospitals are really, really cold. And so if you have, and let's talk about who we're performing a rectal temperature on. These patients are super sick. So this is ER or ICU. This is not your patient who's on a regular floor. They're on the floor, they're probably going to have a thermal scanner if you're not able to perform an oral temperature on them. So in the ICU, sometimes they have a little wire or probe that will be monitoring this person's rectal temperature. That means that maybe they drowned, they were so cold, they were hypothermic, their body hasn't warmed up yet. We're going to have to go on the inside to get a core body temperature. So that's what we mean by that. Question 20, and I think I'm in here so I can get to my appointment on time. So if you want the other 5 questions, that means that you'll have to go to nurseeunice.com, and it's going to be later today. You're going to be able to see the CNA vital sign bundle, and it's $7, but it will give you this whole quiz. It's going to give you an additional quiz also. It's going to give you your flow charts. You're going to need a lot of information for the 7. All right, so question number 20. A CNA measures a patient's respiratory rate at 24 breaths per minute. What is this called? Is it eupnea? Is it bradypnea? Is it tachypnea? Or is it dyspnea? I'm a girl from the South, so trying to say all those medical terms is hard, but I'm going to encourage you to say them because in 10, 15, 20 years from now, you could be the next Nurse Eunice. So, eupnea, bradypnea, tachypnea, or dyspnea. Patient's heart rate is, their respiratory rate is 24. So what does that mean? Hey, Cammie. Thank you, Mrs. Pierce. So yes, you are right, you all. That would be C, tachypnea. So tachypnea refers to an abnormally fast respiratory rate, typically over 20 beats per minute. And so what I want to do is I want to go ahead and take you to this last screen because we have our own custom Ask Nurse Eunice GPT. Yes, so you all, I've uploaded a lot of my information into our custom GPT. So you can go there, you can use it to help you create study guides, practice tests, etc. That website is asknurseeunice.com. But so I got multiple websites. Yep. Multiple websites. But if you want to download our vital signs bundle, you can only do that by scanning a QR code or going to my personal website, which is nurseeunice.com. All of the information will be available in the description area. If you're on TikTok, just look at the profile. You're going to see nurseeunice.com. But if you want to use my custom AI, the one that I built for you, you go to asknurseeunice.com. So everybody, I'll see you all in the next video.